Good morning. I'm Dr. Christine Selvey from New South Wales Health with the COVID-19 update for Saturday the 27th of November 2021. There were 235 cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night. There were more than 62,000 COVID-19 tests reported during that period. Across New South Wales, 94.5% of people aged 16 years and over have received a first dose of the COVID-19 vaccine, and 92.3% are fully vaccinated. Of the people aged 12 to 15 years, 81.2% have received dose 1 of their COVID-19 vaccine, and 76.2% are fully vaccinated. There are currently 174 people with COVID-19 admitted to hospital in New South Wales, with 26 people in intensive care, 10 of whom are being ventilated. Of those people in ICU, 23 people are not vaccinated, 1 person has had 1 dose of vaccine, and 2 people have received 2 doses of a COVID-19 vaccine. New South Wales Health's ongoing sewage surveillance program has detected fragments of the virus that cause COVID-19 in sewage samples collected from Corindi, Eden, Bermagui, Coonamble, South Lismore and East Lismore, where there are currently no known or no recent cases. We urge everyone in these areas to monitor for the onset of symptoms, and if symptoms do appear, to immediately get tested and isolate until you have a negative result. In this phase of the pandemic, the onus is on every one of us to keep each other safe, especially the most vulnerable people in the community. The emergence of the new variant of concern from Southern Africa known as Omicron B11529 is of a concern. New South Wales Health is working with the Commonwealth Government and with other states and territories to understand the implications of this variant for Australia. No new cases of the Omicron B11529 have been detected in New South Wales so far. New South Wales is urging all travellers who have been in Southern Africa, including South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia and Eswatini in the 14 days before arriving in Australia to get a COVID-19 test and isolate immediately. All people in the household of the traveller should also isolate until further notice. Travellers from Southern Africa should also call New South Wales Health on 1800 943 553. New South Wales Health is contacting all international travellers who have arrived in the last 14 days by text message and phone, asking anyone who has been in Southern Africa to get a test and to isolate. Travellers who have indicated on their traveller declaration that they have been in Southern Africa will be contacted first. The emergence of this new variant of concern reinforces the need for all overseas arrivals in New South Wales to comply with the COVID-19 testing requirements. International arrivals to New South Wales must have a COVID-19 PCR test within 24 hours of arrival, and they should have another test at around day 6 after arrival. Travellers who have not been to Southern Africa are not required to isolate while waiting for their test result, unless they have symptoms. However, if symptoms do develop at any time after arrival, the travellers should get tested at a PCR drive-through clinic or any other COVID-19 testing facility. If you or your family are planning to host overseas guests, it's a good idea to make sure ahead of time that you and your family are completely and fully vaccinated before your guests arrive. Please also remind your guests of their testing requirements. Remind them to watch out for symptoms and support them to get tested and avoid high-risk locations. Again, thank you to the New South Wales community for your continuing efforts to get vaccinated, get tested, and helping to limit the spread of COVID-19 in New South Wales. Please stay safe.